Does anybody think our healthcare system works? No. It does not work. It is completely dysfunctional. 45 million people without coverage. Insurance premiums up 100% over the last 6 years. I've laid out a very specific, I don't think there's but one solution, truly universal health care. And I think I've laid out a very specific plan to provide universal health care. I'll just give you a few basics. Number one, mandates that everybody be covered. Number two, we subsidize insurance premiums up to about $100,000 of income. Cover the cracks in the system, which means we treat mental health the same as physical health. It also means we ban pre-existing conditions, no more, outlawed. It means preventive care, long-term care, and chronic care, dental care, vision care, all those things are covered. You can take your health care with you wherever you go, or if you get laid off. If you move from one place to another, you don't have to lose your health care coverage. My plan costs between 90 and 120 billion a year. It's paid for by getting rid of Bush's tax cuts for people who make over $200,000 a year. I want to take just a second, though, and tell you about a personal experience I had just a couple of weeks ago. For any of you who happened to see the Democratic presidential debate this past week, I mentioned it briefly there, but I want to talk to you about it for just a second, because it had a huge impact on me. I did this poverty tour that began in New Orleans and went through a lot of parts of the country. It ended up in the Appalachian Mountains. And I was in the Appalachian Mountains on the last day, and I'm sitting with a small group of people, and there was a man there. His name was James Lowe. He's 51 years old, 3 years younger than me. And he told me about being born with a severe cleft palate. And because he had a severe cleft palate, he wasn't able to talk. Now, this condition was completely fixable. There's a medical procedure to fix it. But he had not been able to pay for it. He had no way to pay for having this procedure done. Finally, somebody came along and did it voluntarily for him, and he got it fixed. Here was the problem. He was 50 years old before it was fixed. He lived for 5 decades in the richest nation on the planet, not able to talk because he couldn't get the medical care that he needed. Now, he was all very kind and noble and grateful about it. It reminded me of a lot of the people that I knew when I was growing up who just worked hard and didn't ask for anything. But my reaction was different. I was outraged. I mean, completely outraged. I mean, how long are we going to stand quietly by and let these insurance companies and drug companies run our country? When are we going to actually stand up to these people? When are we going to fight for the change that we need? When are we going to fight for people like James Lowe? I was listening to that story and I was thinking, all those lobbyists that are all over Washington all the time, I guarantee you he doesn't have a lobbyist in Washington. And I bet there aren't many people in this place that have a lobbyist in Washington, D.C. We have got to fight this fight. That is what it is about. And they will stand in our way every step of the way. Every step of the way. Insurance companies, drug companies, they don't want universal health care. They've got billions and billions of dollars of your money invested in not seeing this system change.